The worst seems to be over in Madagascar. This year, the epidemic was more widespread, with 124 deaths. The almost 2,000 reported cases are 3 times higher than its annual average. Trade and travel restrictions have not been placed on the island, but travellers from Madagascar to South Africa are screened at port of entries.
No cases exported from Madagascar. We have no plague cases in South Africa, and I think that's important. I think Madagascar has a number of measures in place to reduce the export of people with plague. They have exit screening at the airport.
The World Health Organization has identified 9 African countries at a low risk of a plague outbreak. In the Middle Ages, the plague was one of the most devastating pandemics, claiming over 200 million lives. It's still present in parts of Africa, the Americas and Asia. But with modern medicine, treatment is available.
3 main types of plague. We have bubonic plague, which is the type which is spread by the flea or acquired from the flea, where we get painful swollen lymph nodes, which are called buboes. So that's where the name bubonic comes from. Then sometimes the infection will spread into the bloodstream if it's not diagnosed and treated. And then we get bloodstream infection, which we call septicemic plague. And that can be a serious disease in its own right. And from the bloodstream, we can then get spread into the lungs in the form of pneumonic plague or plague pneumonia. And that's really the type of plague which is spread very easily from person to person.
Last year in Tembisa, a rat tested positive, but the rodent problem was quickly dealt with. South Africa last had a human case over 3 decades ago. Hasina Gori, SABC News.